So it's interesting that globally there's obviously a very rapid increase in rates of diabetes across the globe. And even for us here in Toronto and Canada, we're seeing it because of migration, but also there's increased rates within Canada too as the population ages. But one of the biggest issues we're facing is not just the numbers that are becoming more, it's just diabetes is happening at a younger age. So, and the reason for this is that there is some genetic pressures and maybe lifestyle changes that the last 2 generations has had, where they've become more sedentary. And we sit at the computers and we're not as active, and we don't walk and we don't farm as much or do other things we did maybe 4 or 5 generations ago. So the combination of that and increase in pool of genetics has resulted in the fact that diabetes is starting at a younger age. So you see families where the grandparents had diabetes in their 50s and 60s, their children had diabetes in their 40s, and their children are getting it in their 30s. And the 4th generation, we are now seeing teenagers coming in with type 2 diabetes, not type 1, which is from the young age. The name that we used before, we used to call it old age diabetes, which is not the name we use now, we call it type 2. And we're seeing type 2 diabetes in a 16-year-old, which is one of my youngest patients, and I don't even see pediatrics, and I manage as an adult endocrinologist. So it's moving down. So what's happening is that we're getting new, earlier onset of diabetes and more numbers. The problem with earlier onset is that diabetes complications depends on the duration of the disease. So if you have it for 2 years, you usually don't get complications. It's when you have it for 10, 15, 20 years that your kidneys and your eyes and your heart can be affected if you're not controlled well. So that means that we're going to see more complications by default if the age of onset is going to be earlier. What can we do to change this? And I think that's really important, is going back again to the lifestyle. If we can change the lifestyle of our children, if we can work on preventive programs more than just treating programs and treating the patients, looking at how we can prevent, having different exercise program and diet information for our patients very early on before they even have diabetes, and doing some programs in the public for increasing awareness, I think will help this.